Cardiovascular pathology, conductive blocks. All right, so I'm going to run through these blocks rather quickly because they surprisingly are not high yield. They don't talk about them. They don't ask questions about them. I've seen probably about like 2 questions maybe, and they've all talked about complete heart block. That's it. So it's very surprising. So here we go. First degree AV block is going to be prolonged PR interval. Okay, so if you look at the PR interval and they're all equal, but they're all relatively longer than normal, so greater than like 1 box, greater than 200 milliseconds, then you know you're dealing with first degree AV block. Okay, so just PR intervals are equal, but they're long. Okay, Mobitz type 1, which is second degree AV block type 1. Okay, so second degree AV block type 1 is going to have a regularly irregular rhythm. Okay, unlike AFib, which has irregularly irregular. This one's regularly irregular. So what happens is that we have the PR intervals are going to go long, longer, and then it's going to drop. Okay, so you're going to have the first PR interval is going to be like, let's say normal. And then the second PR interval is going to be a bit longer. And the third PR interval is going to be like longest. And then the last one, you're going to have a complete drop of your QRS complex. Okay, and the way that they remember it is longest drop. That's the story of Wenke block, because Wenke block is known as second degree type 1 AV block. Okay, easy, quick. They're not going to ask you a question on it, and if they do, it's easy. Next is Mobitz type 2, which is second degree AV block type 2. What you have to know is that the drop beats are not preceded by anything that's like longer drop. It's just random drop beats. Your PR intervals are not long. Okay, they're not elongated, they're normal and they're equal to each other, but you just will have a random QRS drop, okay? And then lastly, the one that they actually might ask questions on is third degree complete heart block. Okay, so what's complete heart block mean to me? All that this means, okay, is that my SA node and my AV node are not speaking to one another, okay? That's it. That's all that it is. So the atria and the ventricles are beating at complete separate times, okay, in rhythms. They are not paying attention to each other at all. So that's why they call it complete heart block. There's no communication between the atria and the ventricles, okay? They beat independently. Now, what does that mean for our P waves? Okay, so the P waves are going to be normal, okay? So you're going to see the P waves because the atria is beating fine, okay? And it's going to be beating in rhythm. So you're going to have the P wave to P wave, the first P wave to the second P wave, it's going to be equal. And the same thing with the second P wave to the third P wave, it's going to be equal. So those distances are all equal because the rhythm and rate of the atrium is fine. It's beating normally, but it's not connecting with the beats of the ventricle. And the ventricle by itself is beating normally. Your RR intervals are equal and normal, okay? But when you put them together, you see a bunch of random P waves that aren't followed by QRS intervals, and then QRS intervals that don't have P waves preceding them, okay? So that's all that it is. You're going to have regular RR intervals and regular things like that, okay? And what you have to know is that the bundle of His in this situation becomes the pacemaker. Very odd, because as we said, the SA node is mainly the pacemaker. But when the SA node's out, the bundle of His now has become the pacemaker, okay, of the heart. Because usually it goes SA to AV, then the pacemaker, or then the bundle of His. But now we've got rid of both of those. So now we have the bundle of His as our last pacemaker. And that's what we see for our complete heart block. And the reason we see that is because we have complete AV nodal degenerative changes. And that's why we have the third degree complete heart block. Okay? So make sure to understand that you have normal PP waves, intervals, and you have normal RR intervals, right? Completely fine. They're just beating separate from one another. You have the bundle of His becoming the new pacemaker, and you have the AV node degeneration. Okay, that's why the bundle of His now has becomes the new pacemaker. Lastly, this can be caused by Lyme disease, and so just keep an eye out for that. There's an association with Lyme disease for complete heart block. And then lastly, for bundle branch block, I don't want to waste your time, and I don't want to waste mine either. So honestly, don't worry about it.